Are you Tamara? Excellent. Dr. Campbell, nice to meet you. Hi. Hi, Mom. My name is Dr. Scott Campbell,
Nice to see you.
and I'm a family doctor in Montague, Prince Edward Island. I've been practicing medicine in a standalone practice now. We're in our 4th year. My own particular path to medicine is somewhat different than most. Historically speaking, as I was saying, most people do the traditional science degree right into medical school, and the majority of my friends did that way. Unlike the majority of my colleagues, I was really not interested in medicine starting out, and so I really pursued a career in research first. That didn't work out, and really fell in love with medicine. Unfortunately, because I'd never really tailored my education toward applying to medical school, I was lacking some of the requirements that were needed. So I had to take a little bit of extra time and not only redo some courses, but also do some new courses. Unfortunately, I was not able to get into a Canadian medical school, but I was fortunate enough to get into a Caribbean medical school. And so I followed my dream and went to medical school outside the country. I lived in the Caribbean for 2 years, did my classroom work. Then I moved to the United States for 2 years, and I lived just outside New York City. I did my clinical work there for 2 years, and then subsequently came to St. John, New Brunswick, where I completed my family medicine training. Within family medicine itself, a typical day can be extremely varied. It really depends in what population of people you service. You have a variety of responsibilities based on the community programs that are available, or really the community resources that are available. So the typical day generally, if it's an office-based day, for most family doctors, is to present to the hospital, usually around 7 to 7:30 in the morning. You spend some time seeing the patients that you have admitted to the hospital, making sure they're okay. Usually return to the office between 8:30 or so, do a little bit of paperwork, make some telephone calls, start seeing patients around 8:30, 9 o'clock, and generally see patients for the vast majority of the day, usually 3 to 4 o'clock in the afternoon. Then finish up the day with a little paperwork, and then home after that. However, if you're in a more rural setting like we are here in Montague, our responsibilities that we have to the community here are a little bit more involved. In order to work in our setting, you're responsible for working in the emergency room. So if I'm working in the emergency room, I'm generally in the emergency room from 8 o'clock in the morning till 10 o'clock at night. Some nights I'm there maybe till midnight or 1. When you're on call for our department, you're responsible for looking after the people you have in the hospital, as well as your colleagues, patients in the hospital overnight, and then until they get there in the morning. The rewards of being a family doctor really can be summed up in 2 words, and that's really a happy heart. Being able to care for a wide variety of people, whether it's newborn babies, expecting mothers, teenagers, adolescents, adults and elderly, in a variety of settings, really gives you a sense of accomplishment. And ultimately, you know that at the end of every single day, every single encounter you have had with a person always has the potential to be meaningful for that person. There's no wasted time in family medicine. Everything you do can be important to somebody. The absolute best thing about family medicine is looking into a patient's eyes after you've been able to help them figure out a problem and improve the quality of their life. And when they look you in the eye and they stick out their hand and they say thank you, you can understand that all of the late nights, all of the long study, all of the work, all of the sacrifice is absolutely worth it. You feel so wonderful to be able to help people, really not only in their time of need, but a lot of times in their most intimate time of need. So my advice to anybody who is seriously considering to enter a career of medicine, irrespective of whether it's family medicine or another aspect of medicine, is to commit to it. Make the decision, commit. Don't let anything stand in your way. It's a difficult path, but people do it every day. And if you'd like to do it, don't hold back. Just go do it.